Hello, everyone. My name is Sue Bahnan. I'm physically located in Worcester, Massachusetts. Um, I've been in touch with Gabriel now for a few years and have attended um, three different semesters of the formal training of the work. Um, so I have a background in, I have a master's in neuroscience and I have a master's in psychology. And I'll just sort of map out, I guess, a little bit of my own journey. Um, I was certainly always interested in how to do this human thing correctly. Even as like a young person, I sensed that we weren't really seeing things clearly enough. And I didn't feel that our systems, our institutions were set up in such a way that treated the root of suffering or disease or what have you in human beings. And so I initially set out to study psychology. And upon getting an undergrad degree in psych, I was like, it's kind of a gray area. It's so relative or subjective. I know what I'll do. I'll study the brain. So then I enrolled in a Master of Science program and studied the brain. And even after that, I did my thesis on stress and trauma. I was like, this is a really cool organic biocomputer we have going on. But it seems to be only localized here in terms of how we formally study what we call the brain. Um, and it doesn't necessarily answer all my questions. So I went on to work in neurofeedback in different clinical offices and did some content writing and then I found heart math, and that was an interesting piece in the sense that there was finally this area of formal study that brought forward an idea that there was a brain outside of the cranium. And I was like, okay, now we're getting somewhere, right? But there still were some things left, unturned. Um, and then I found polyvagal theory. And by now, I was getting a master's in psychology. And it was interesting because even when I was younger, there was something in me that didn't want to take the clinical track to become a licensed mental health counselor. My young self didn't like how heavily we were utilizing and perhaps even abusing pharmacology, although it certainly has its place and its uses and its effectiveness in certain scenarios. So there was a part of me that was like, I don't know. I don't know if I want to become part of this system and train myself in this way. So eventually I took a coaching track. And so I was like, I can utilize my academic training and I can become a coach. And so that was really wonderful. And I was able to sort of piece together these different elements that I thought addressed what it means to be human in a more holistic way. I was able to bring in, neuroregulation practices, nervous system regulation practices, components of, how to work with thoughts, how to interact with emotions, so emotional intelligence and different things like that. And then I found Gabriel's work. And the reason why I was so blown away by the Hearth Science area of study is because it finally brought together all of these pieces that I had to go to separate areas of study to find. And it brought them together in this sort of unifying framework, including ancestral wisdom and indigenous knowledge and practices of healing and maintaining well-being. So that was, I think, something that was incredibly unique and rare, especially within Western science, right? And so here we are now, and bringing the autonomic nervous system into more of the centralized focus just really opens, I feel, everything and brings the multidimensional aspects of what it means to be a human being and what it means to maintain our wellness as a human being into balance. And of course, you can do so within any scope, whatever area of work that you are professionally trained in yourself. So I just absolutely fell in love and continued to show up to pretty much everything that Gabriel offered, and made myself present in all these different circles. And it's just been an absolutely wonderful experience. And so I continue to integrate what I learn in the Autonomics framework into my coaching. I just had a 2-year position at the district attorney's office where I formally trained different professionals in law, first responders, police officers, but mainly teachers, actually, who were working with children. And it was really wonderful because I was able to sort of help them shift out of this behavioral paradigm that we've been stuck in, and helped them shift into more of a nervous system focus. So don't get stuck on the behavior. Stop taking the behavior personally. What might be beneath the behavior? What is the nervous system of the child communicating to you?
Oh, okay.
And
Well,
how might,
I just want to say, like,
oh, yeah, and how might you be able to utilize tools as an educator to communicate directly to their nervous system in response. And of course, also a major component of that was teaching them how to take care of their own nervous systems, right? Because many of you may be familiar with this concept, or the principle of co-regulation, right? So if that stands true, then it's really important for us to allow teachers, just as a continued example, the opportunities to create communities and that are co-regulatory amongst themselves, right? So it was just a really wonderful experience to see how I could apply all of this work into a very unique environment through the district attorney's office. And now I'll be moving on to a more clinical oriented track. But yeah, so here I am. I feel really grateful to be able to teach the spring semester in Autonomics, which we'll talk about in a bit. But yeah, perhaps we can begin our conversation, Gabriel, about what this framework is. And
Yes, Sue, thank you. It's a lovely introduction, and it's been really fun for me to listen to you tell a little bit of your story and share it with the folks kind enough to join us today. So I think, in the spirit of this dialogue and this back and forth, I think maybe what I want to do is a little bit of context setting with respect to our work in a couple of different ways to complement some of the things that you've said. And I think there are sort of, two contexts that I would like to set. And I think the first one is kind of a lineage history of our work, just to, for some people, inform, for some people, reiterate some of its origin stories. And I think the first thing that I want to say on that side is that I've been working toward this for 30 years. And I don't think that most of that, initial, let's say 10 or 15 years, I was conscious that I was working in this direction. I think it's one of those things where, at the time I felt like I was moving in many, many different directions. And then you look back and you realize it's like a straight line. Sometimes a phenomenon of looking back at a long, long duration of time. So I think what I was trying to do first was heal. It's really that straightforward, right? I had a very, wonderful in certain ways growing up. Had a couple of discrete events that were traumatic of displacement. One of them that was very salient happened when I was 7 years old and got pulled out of a context and community that I had been a part of since I was born. And didn't know what happened, right? Didn't have language for it, found myself alienated from myself in a way that I couldn't put into words in any way, shape, or form. And I think that, my early kind of, college experience, early adolescence, I was just kind of feeling out of control, grappling, trying to find a way to steer myself. And so I think, the first 10 years or so of the work were really that. And the point where it maybe shifted for the first time was in my early 30s. I started working with incarcerated youth. And I had the good fortune to teach for an organization that was teaching mindfulness to young people who were in detention contexts. And mindfulness was something that I had discovered myself when I was about 19. And it was, I think, the first real sort of daily practice that gave me some degree of handle on my inner world. some degree of ability to feel like I was having agency and shaping how I was doing. And we started working with young people, and I'm not an obvious candidate to have worked with those people, those young people, because most of them were young men of color, and our life experiences were very, very different. But I had a really deep sense of what it meant to be alienated from your own heart. And I had a kind of willingness to be authentic with them, which was the primary request that they made of us. Just be real with us. And I got very into this study of applying mindfulness in this context with young people who had, a fair amount of trauma. And just to notice that even if you had no trauma coming into contact with the juvenile justice system, the very encounter is traumatizing itself, right? So we were in this kind of liminal state with young people in this interesting kind of transitional opportunity that in certain ways resembled a monastery, as weird as that sounds, right? People didn't have their ordinary clothes. They were sort of stepped out of their ordinary lives. We were doing mindfulness with them. And I think the degree to which trauma was shaping the way that the practices were received became obvious to me for the first time. And I think in the context of this organization, we realized that the way that mindfulness is being taught in modernity is really lacking awareness of the degree to which the nervous system mediates our attention. Our attention and the way it works is derivative of autonomic state. And again, I couldn't have said that at the time, right? But I started studying trauma healing modalities. We got connected to Peter Levine's lineage of somatic experiencing, some really phenomenal teachers there. And then again, I had this moment, and it was a moment in probably 2010. I was working with somebody named Twig Wheeler, and he started teaching us polyvagal theory. And when Twig taught polyvagal theory, uh, he made this analogy to a geologic map in Great Britain. And it's known as the map that changed the world. And the way he taught polyvagal theory was this notion that there was this deep kind of geological map of the nervous system that was beneath language and culture, and that we could learn to speak the language of that. And it really, I have had the good fortune to have several mentors and several moments in my life where I saw there was like a directional shift. Because what learning polyvagal theory did for me is it gave me a language to understand at a visceral and experiential level what had happened in my own growing up. And so I spent the next, I think, 10 years refactoring my experience of my childhood. And it was very important because I'd spent a lot of time as a kid in a really deep connection state when I was really little. And then I'd been ejected from it very violently when we moved. And, when you're ejected from a connection state, in my case, I went into a pretty severe shutdown. My experience of myself and the texture of what it was to be in contact with myself changed really dramatically. And I hadn't understood why. And I was able to, with this lens and this language, begin to reassemble a coherent experience of myself inwardly and heal some of these things. So, I mean, I feel perpetually in the debt of Steve Porges and polyvagal theory. And, in 2013, I had another experience like this where I got to sit in a very, very small seminar with Darshan Narvaez. And if you're not familiar with her work, I strongly recommend it. It's one of the foundation touch points of our work. She's a professor emerita at the University of Notre Dame. I think she's probably retired functionally at this point, but she wrote a book called Neurobiology and the Development of Human Morality in 2014. And we were meeting with her a week before, or a year before the book came out. And she basically, sat down and the first sentence out of her mouth, she said that small band hunter-gatherers are the baseline of human normalcy. And I remember, where I was sitting at this table, it was on the seventh floor of a building in downtown San Francisco. There was a Giants game going on. You could hear like horns on the street. She was this demure little lady from the Midwest. She was very conservatively dressed. She sat down, she said this, and it just completely stopped me in my tracks. And I turned, I looked at her, I go, "What did you just say?" And it was a super rude response, but I was just so taken aback by what she'd said. She said again, small band hunter-gatherers are the baseline of human normalcy. And I go, "How is that possible?" Now, this is like a super rude thing to say or like rude way to interact with somebody, but I was just like, "What are you talking about? How can that be normal?" I said to her, like, "How many people in the world are small band hunter-gatherers? I don't know any of them. Like, what is that, 1/10 of 1%?" Which is actually what it is. And she kind of looked at me, and I think was trying to discern whether or not I was just an asshole or whether it was a sincere question. And when she discerned that it was a sincere question, she said to me, "You have to understand the lineage history of the species, which, depending on who you ask, is 2 million to 200,000 years. And that the lineage history of the species is that the contexts in which our brains and nervous systems evolved was a small band hunter-gatherer context. And in that context, and this is me interpreting her work now through a nervous system lens, in that context, you have a certain set of inputs to your nervous system that are very consistent, that are very different than the inputs we're getting in modernity. And for me, again, this was a moment where I think you could say in a way that our work is sort of the marriage of mindful awareness, this view of this deep ancestral context as expressed through indigenous lifeways, and autonomic physiology. And those are kind of the three of the foundations of the stool, if you will. So this is kind of how the work emerged. This is where it came from. And then, I can talk a little bit more about the contemporary history of it in a little bit. But I think the other thing in terms of context setting is looking at epistemology and how we know what we know. And I think this is important for me to say at the outset, right? Because I've been trained for 30 years as a tracker in both hard ground tracking in an indigenous context, which is like, paw prints on the ground kind of thing. But the way that I've applied that is to the autonomic nervous system. And so there's a methodological difference in the approach that we have, right? I have a 30-year background in mindfulness, and then I've been trained as a tracker. And so a lot of what I've been working on is a cartography that's an inward cartography of the ANS. And, in the same way that, well, this sounds ridiculous when I say it, but in the same way that, Santiago Ramon y Cajals, who developed neuroscience, was a visionary artist who applied that method to the study of the neurons, right? This way of knowing that was an unorthodox way of knowing that gave rise to the discipline. We've applied a way of knowing, and then we've tested it really rigorously. So it's coming from a different place in consciousness. And I think that's important to name at the outset. The methodology is a different methodology. So these are a couple of lenses on context. And then, yeah, I think a lot of what I've been focused on and what Hearth is focused on is salugenesis, is how do we create the conditions for well-being in a modern context that, frankly, is very gifted at evoking our threat responses. So I'll stop there and kind of hand it back to you and we can figure out what's next.
Yeah. That last sentence was so real. Felt that as far as our current modern ways of living. But I think a good place, so you mentioned, being trained as a tracker and having, these personal and professional investments in cartography. And as that overlaps with the study of neuroscience, the study of neurology, can you say a bit about what does cartography mean within these studies, within these fields of study? And where are they erroneous? What are the impacts of those errors? And what is Hearth Science doing as far as paving way towards rewriting these maps?
Yeah, it's a great question. I mean, it's a big question, and I think so. I'll point at some of the. I'll give you a salient example and then point in the direction. But we could spend 18 hours talking about this. So I had the good fortune in 2019 to work with Dr. Porges on a set of posters. So long story short, I connected with Dr. Stephen Porges in 2019 after having studied polyvagal theory for about a decade. And when we were introduced and began to have a dialogue face to face, I asked him if he would consider allowing us to try to illustrate the polyvagal theory. And, at this point in my own career, I was teaching it all the time. I was doing a lot of work with frontline facing clinicians. I was doing a lot of training on resilience. I was doing a lot of training on sort of applying mindfulness to working with different clinical populations. And I was having to make diagrams, I was having to try to draw it to explain it because the theory, the book that he that first kind of brought it to popular awareness, the polyvagal theory, the 2011 book, is essentially a compilation of research papers. And it was very dense and it was fairly technical. And I was trying to like make it more accessible, and I thought if there's a picture of this and people can see the neural circuits, they'll understand this much more immediately, which we should because it's talking about our direct experience, right? So for me, this, work to like unveil the technical language is a really important part of the project. So there was this moment where we were working on the subdiaphragmatic vagal systems, right? So for people who may not be familiar with this, there are multiple vagal systems. The reason that it's called polyvagal theory is because Porges, recognized that what we call the vagus is a conduit. It's not a nerve. It's like when they put in a pipe under your road and they flow the cable line and the telephone line, they throw all these different lines into the same conduit. The vagus is a little bit like that. It contains a number of different circuits that are, bunched together. And, he had differentiated for the first time that there were, these two different vagal circuits that undergirded two distinct behavioral repertoires. One of them he calls ventral vagus, ventral vagal. One of them he calls dorsal vagal. He was aware that they have different brainstem nuclei that they're attached to. Okay. And what we were trying to do was make a drawing of the subdiaphragmatic, like the vagus in the guts under the respiratory diaphragm. And so what I was trying to do was find an authoritative rendering of that in a neuroanatomy text. And I encountered this problem, which was that there was an incredible degree of variation in the drawings. Right? Some of them, it looked like there were just a few nerves into the guts. Some of them, it was more robust. Like it was too variable. You know what I'm saying? Like for 200 years into the discipline, the amount of variation was too great. And so I was studying this and I was like going and finding obscure atlases of neurology to look at the diagrams of this system. And I had this weird moment where I was on the table of a body worker who had been trained, in a variety of different things. But he was, a colleague of mine also, and he knew how interested I was in autonomic physiology. And so, and you should, I mean, try this. This is a really fun thing anybody can, do if you're into the ANS, is have a body worker on you, working on your nervous system, talking to you about what they're working on and feeling it from the inside. And so he's working on my system and he gets under my rib cage on the left-hand side and he's sort of, palpating. I'll see if I can get the camera to show you where it is. Like here's the rib cage. I'm gonna jump. My screen is too smart for its own good. It's on the left side right there, right? He's palpating this area and he goes, now I'm palpating your celiac plexus, which is a portal to your dorsal vagal system. And I literally grabbed his hand and I sat up. And he like startled because I was, we were like deep in the middle of the session, 45 minutes in, I was totally relaxed. He like puts his hand, he goes, I grabbed his hand and I sat up and he goes, what's wrong? And I go, what did you just say? He goes, your celiac plexus. I said, no, after that. He said, it's a portal to your dorsal vagal system. And I go, how do you know that? And he goes, what do you mean? And I go, I've never heard anybody say that in my life. I'm talking to the world's leading experts in the subdiaphragmatic vagus. How do you know that? Who's telling you that? And he starts thinking about it and he goes, well, there's a French guy named Barral. I studied this thing called visceral manipulation. I'm like, who's Barral, right? And the sort of meta phenomenon that was happening was that I started to realize, okay, first of all, there's a really big difference between anatomy and physiology here, right? Like we can understand the way the circuits look. We can understand where they are in the body. It doesn't mean we understand what they're doing. It doesn't mean we understand the systems and the responses that they subtend. So that's one thing. The other thing was like this knowledge is siloed, and there are parts of it that are in different disciplines, and there's not a whole lot of transdisciplinary dialogue to liberate them across these disciplinary lines because essentially you have this one line of osteopathy that knows that. But they don't say that in their trainings because they don't use polyvagal theory. And so, you have the situation where you have a very, specific understanding of a circuit physiologically or functionally, but no one else outside of that world knows that. And it was this moment for me where I was like, oh, the maps that we're getting, that we're inheriting here, are not necessarily accurate or complete. And I think, I have a sort of disruptive nature, I guess. And so what I think it did for me was it gave me permission to throw out a lot of these maps and begin to explore them more interoceptively. And then just to kind of wrap that story up, we ended up finding this French surgical atlas from the 1860s, which is sort of popularly known as the most beautiful surgical atlas that exists. It was written by these French anatomists. It was republished by Taschen, which is a German art publisher. And when I started looking at their maps of the subdiaphragmatic vagus, like it just absolutely like dropped my jaw because it was 10 to 50 times more dense with neurology than any other map I'd ever seen. And the thing I realized, and this is sort of like a patently obvious observation, but sort of jaw-dropping at the same time, is that if you can feel your body on the inside, you have neurology there. Like just by definition. Like the only way you can interocept in a place is if you have neurology. And if you think about your inward landscape as like being, pixelated, like how high is the resolution? Is it, 72 pixels an inch? Is it 150? Is it 300? So the higher the resolution of your ability to resolve the location of something in your interoception is a pointer to the density of sensory afferents in that place. And the more refined my meditation got, the more precise my interoceptive tracking ability got, the more I realized like I couldn't feel this if it wasn't fully innervated with neurology. Right? I mean, it's just a reality of how the body is, constructed neurologically. And, just, I mean, I could keep going, but, there's every square inch of human skin has 9 square meters of C tactile fibers in it. C tactiles are ultra fine autonomic fibers. You know how they're like, if you buy fancy sheets, they'll be like, oh, it's 300 thread count. It's the cross, the warp, and the weft of your sheets. So your skin is 3,500 thread count autonomics. Your skin has 7,000, per square inch of these ultrafine fibers running through it. 7,000. They're 1/3500th of an inch thick. They're a fraction of a human hair. They're way thinner than human hair. So you imagine the density of receptors tied into that network. If you were to take the skin and you were to disappear everything in it but the neurology, you would still have the complete skin. If you were to take the interior of the body and disappear everything but the neurology, you'd still have the complete body. This is what people don't understand. So the version of neurology that we all got taught is like, a dead tree in the middle of winter. And the reality of your living neurophysiology is a tree in the middle of summer. Like you can't even see the nerves because they're ensheathed, right? And the thing that's powerful about that is that it means essentially the whole body is a portal to transforming your neural inputs. And, we've spent an incredible amount of time trying to get into the brain, which, for very good reasons is inaccessible. When the primary conduits to altering neurology can be done non-invasively through all these portals in the body if we just know how to read that map.
Yeah, you're already heading into the direction that I was going to ask this next question. Because obviously we've sort of made a mess of things with these faulty maps that we've had. Especially here in the United States, our healthcare system is unnecessarily complex and segregated, and often just perpetuates and exacerbates suffering and disease by elongating the process and keeping it at a very surface level. It really does not reach, it doesn't penetrate into, of course, the autonomic physiology of one's body, but also the felt sense, perhaps even in like the emotional quality, which is also really important information that is born out of um, the autonomic state in which you are in. So many of these things are not seen as valuable and therefore disregarded and not inquired about within our healthcare system, which is very unfortunate. And it certainly doesn't teach individuals that they have the capacity to tap into their own autonomic state and neurology in any given moment and develop these tracking skills within themselves over time. So it continues to breed this sort of dependence on a system that doesn't even quite do a good job, especially when it comes to these more complex conditions, autoimmune disorders, chronic pain and illness, so on and so forth. Anything to comment on there, Gabriel?
Yeah, I mean, I agree with what you're saying. I think, we can say allopathic medicine doesn't teach these things because it doesn't know them. It's not a fault. I mean, it's not that the system is withholding this information. They don't understand this.
Yeah.
And, you look at the origin of allopathic medicine, it's, very, very connected to segregating the mind from the body. Like that's where it comes from in terms of its intellectual history and its, the accretion of medical knowledge, right? There's a mind body split that's really foundational to the way that it's organized. And so it's systematically misdiagnosing stress related disorders at scale is a kind of blunt way of saying that. Sorry, I'm going to close the window. So, depending on who you ask, I mean, somewhere between 60 and 80% of what drives people into primary care is stress related, right? Or exacerbated by stress. And, anything that's stress related implicates the ANS. And anything that implicates, sorry, the autonomic nervous system, and anything that implicates the autonomic nervous system is a mind-body issue. It always is. And so a medical system that compartmentalizes the body to like an increasingly specialized set of practitioners on the one hand, and the mind, to either, psychiatry or mental health on the other, it's always going to be partial in its view of what's wrong. And so, what we've been saying for a long time is you centralize autonomic physiology in the diagnosis and treatment of stress-related disorders, it changes the diagnostic taxonomy completely of what you see. And then it changes what the methodology, whereby you intervene and how you treat it.
Right. Yeah, so let's say that we have these updated maps, right? The Hearth Science maps that are being created and continue to be created because there's still so much to both rewrite and discover through this lens. How does that change the face of medical practice? And also, like, how does that change just the quality of life of the individual, right? Like,
Well, okay, so I'm gonna just, yeah. So how does it change the practice? So I think what happens often now is that let's say that, I have a stomach ache that doesn't go away. I have non-resolving gastrointestinal distress. I go to primary care. And what often would happen is that my primary care physician would, do sort of like eliminate organic dysfunction, make sure I don't have a tumor, they'd probably do blood work. If they're convinced that the issue I'm having is a gastrointestinal issue, they're then going to send me over, they're going to refer me to a gastroenterologist. Right? Does this make sense to everybody? This pathway? They send you over to a gastroenterologist, right? You go over to the gastroenterologist. Again, they're looking for organic dysfunction. Depending on how long this is endured, right? I might have, they might find that my gut flora is out of balance. They might find that, my digestion is, the peristaltic rhythm is disrupted. I mean, there's any number of things they could find. But I think part of what's important to understand is that the purview of that specialist is the guts. But your digestion is probably, statistically disrupted because your autonomic nervous system is in a defensive response and it's been therefore downregulated, right? And the downregulation of that system doesn't happen in the guts, it happens in the nervous system, which then turns down the volume, if you will, on the guts. And so you can do a correction that intervenes at the level of the organ and tries to rebalance gut flora, etc. And you can have benefit from that, but it doesn't address the systemic roots of the issue, which are in the autonomic nervous system. And what often happens at that point in that setting is that if it's not progressed, often there's a clear progression from gastrointestinal distress to some kind of development of inflammatory bowel disease, ulcerative colitis. Like there's a whole sequence of things. But if it's not progressed particularly, they go, well, there's really nothing organically wrong with the guts. We actually think this is in your head. And then they send you to psychiatry. And then they ask you, go over here to, psychiatry. And then the psychiatrist writes you a script for anxiety, right? I mean, this is just a typical pathway, right? And then the person says, well, I don't really want to take this drug. And the person says, well, it sounds like you have anxiety. And then, they take the drug and then it has side effects they don't like. And then they go back to primary care and they're like, I don't like taking this drug. But at no point has the root issue been addressed because the root is physiological, that the body has shifted into a defensive response. It's altered, it's altered organ function because that's what the ANS is capable of doing. The ANS, it is the master control switches on all of your visceral organ function. So it turns stuff up, turns stuff down. It'll do that, right? So yeah, I mean, so how does it change practice? Well, if we could go directly into a diagnostic where we differentiated, what is the defensive response, and then treat that directly, then we treat the roots of that issue directly. And then you don't have to do any of that shit. I mean, just to, be blunt about it, right? And, how does that change quality of life? Well, it puts you in the driver's seat rather than being, 4 stages down at the mercy of 4 different specialists, having just paid your insurance deductible, whatever that is, and not feeling better. Now, I'm giving you like a simplified case, right? But you understand the sort of general logic of what I'm saying.
Yeah, one of the things you said earlier that really stuck out to me, especially as far as just like our daily life, is this concept of neurological inputs, right? So when you say salutogenic ways of living, is life creating and life sustaining ways of living. And so when we centralize autonomic neurology and autonomic physiology, also just within our own understanding of self and how we move through the world every day, then rather than solely focusing on all the different things that are going wrong and the aches and the pains and the dysfunction, if you will, which is of course important, but also just realizing that those are signposts that tell us that our inputs are off, right? You mentioned this ancestral context in which 99% of time, the neurology that lives within the human being was embedded in. That was the environment in which it was receiving these inputs naturally. Now, of course, there's cultural differences, regional differences, depending on where on the globe you are. So, of course, we account for all of that. But it's been an unlearning and a relearning, even for myself, where rather than solely focusing on, oh, what's wrong and what do I need to fix, I've now shifted just the basic burning of that energy and focus, resources, right? Time, money, energy, all these different things to what inputs do I need today, right? And recognizing I didn't get a moment sitting outside in nature. I didn't have food that has light in it. Let me go eat some vegetables and some fruit. I've been alone for 72 hours on my computer in deep research. Why don't I go like grab a drink, a cup of coffee with my friend or go see my family, right? When we can shift our ways of thinking so that they become second nature, we know them by heart, right? Where we're utilizing, prioritizing these inputs that we know work for us personally, because we're all different. It has radically shifted my life. And there isn't as much of a need to think that I need to rely on a physician. Perhaps if I get an infection or if I get an accident, thank God we have, the emergency room, and allopathic medicine is wonderful when it comes to those types of things. But when it comes to basically managing my inputs and outputs and managing my stress levels, and then also managing my salutogenesis on a day-to-day basis, it's just radically shifted um, a sense of empowerment, if you will, which I know that word is used often, but the fact that like I actually have capacity to control this. And it's been a really beautiful shift for me personally. And I know you've reported a lot of different, um, anecdotal data too from many clinical patients you've worked with as well over the years.
Yeah, I think it's a really beautiful story that you're telling, and that shift is sort of what we're, I think, trying to help people find. And just to kind of, I think, emphasize or complement some of the things you said. I had an interesting career in the sense. So when I left, I was the executive director of an organization from 2006 to 2009 that did this work with incarcerated youth, and then I founded the company that's become Hearth Science. And our first client for that company was a woman. At the time, her name was Nadine Burke. She got married since then. Her name is now Nadine Burke Harris. At the time, she was running the Bayview Child Health Center in San Francisco, and she was the medical director of this pediatric clinic. And she was our first client. And she had gone to become the first Surgeon General of California. She was tapped by Newsom's administration, and the signature sort of a focus of her work was on ACEs, adverse childhood experiences, and the transformation of them at scale. So she introduced me when we were working to her mentor, Dr. Vincent Folletti, who's the co-principal investigator of the Adverse Childhood Experiences Study. And I had the opportunity to interview him several times. I've been in conversation with him for a number of years, and I got to interview him several times. And um, there's a bunch of stuff he said that stood out to me, but nothing more than this awareness. He goes, the thing that we're often treating as the problem in public health is actually generally someone's solution to a much deeper problem that we can't see. Right. And so, if you kind of carry this out a little bit and you go, okay, so an autonomic state that's uncomfortable is actually your body's solution to something. If I'm experiencing anxiety, that's my body's best solution to something. And if I can have that awareness, then I go, what's the problem it's trying to solve? Does that make sense? And then I go, probably it's some kind of threat I'm experiencing. Right? Does that make sense to you? And, just to differentiate, so the Western medical approach would be, well, you're experiencing anxiety, that's uncomfortable, so let's shut that down. I think that's not a good idea because, and I understand that in certain limit cases that's necessary. I'm not anti-pharmaceutical, but most of the time, my sense is that if you do that, you're basically taking away your body's innate compass. The anxiety is your body's method of telling you what's wrong. And it's our job to learn to translate that. Like we have to become fluent autonomically so that we understand, oh, if that's the solution, this is the problem my body is addressing. And these are how I would change the inputs to my ANS such that that will transform. And, it sort of tracks back to this thing you were saying earlier. Like, you look at the ancestral context, you go, people for the first, 99.9% of our lineage history, they couldn't be inside unless they were in a cave. Our material structures were not sophisticated enough to seal out the outdoors, right? So they were outside 99% of the time, right? Modern Americans are outside 7% of the time. So we've basically flipped the entire ancestral context. So something I say to people often is like, if you don't feel good, just go outside. Because I mean, some of these things are very simple. Like if you can sort of recreate at some level the inputs that are more ancestral, it's likely to help your system, move in the direction of well-being, right? Like we go around through the world with our feet wrapped in rubber. Like that's not, like most of human evolutionary history, like our feet were bare and they were on the ground. We have an extraordinary, proliferation of nerve endings there. And our indigenous mentors tell us very frequently, like the earth is always transmitting information to us through our feet. Like it's a way of knowing. So modern people generally are not in contact with that way of knowing, partly just because there's no contact, right, with the ground. So some of these adjustments, they're both profound and they're very simple. And it's sort of looking at like how do I reorient so that my nervous system is getting health creating inputs. And, we have to kind of step out often of kind of the received modes of living that we've been acculturated into, I think, to do that.